But I had some great teachers in high school, and they helped me, and I was able to learn the language pretty quickly. It took me 1 year. By my sophomore year, I was already speaking English, so uh, the school slowly transitioned me into all English classes, right? No more ESL, which was great. Um, so I started to excel in high school. I was able to graduate and apply for a 4-year college and was accepted at University of California, Riverside. This was back in 1989, so that kind of gonna age myself there a little bit.
Yeah.
So I did that. Uh, when and I left to go to college, and that's when all hell broke loose for me.
Mm,
But to put it in better words, um, I started drinking a lot, using alcohol, um, and would go out with my peers and my friends. First, it was Friday, Saturday, right? It was first, and then as time went on, it was Thursday, Friday, Saturday, and then it was Wednesday, Thursday, Friday, Saturday, right? And then
yeah.
next thing you knew, it was the whole week. Right. So I slowly became really, truly, when I think about it, I became an alcoholic, right?
Mm,
Um, and we all know when we're using substances, then we make poor choices. And I made the poor choice to start using methamphetamines, which were
mm,
introduced to me by some other people that I knew. And I started using methamphetamines heavily in college. Um, I barely graduated.
mm,
And it took me 6 years to do what takes most people 4 years to do. But I graduated with a bachelor's degree from UC Riverside, and I continue in my addiction for many more years. I had an addiction run of about 10 years long. Um, During that time, now looking hindsight, um, because you don't realize these things when you're going through things, right? I really, I was suicidal. I wanted to die. I didn't want to live. Um, my parents were elder already. I was kind of like an afterthought. I always told them that I was an afterthought. They had me in their later years, so they were elderly, and I just couldn't imagine my life without them, you know.
mm,
And so I
mm,
wanted to die first, right? That was
yeah.
my mission, to do that. And so the drug use continue and all of that. Eventually, back in 1999, God God brought the help that I didn't want, because I didn't want any help. I thought
Mm,
nothing was wrong, everything was fine. And when I look back now, even throughout my addiction, I see how God took care of me, right? God was always there. Uh, he had a bigger plan for me, right, that I didn't even have any idea about. And
mm,
in 1999, I was arrested. I was thrown in jail, and they threw the key away because I was looking at doing about 20 years in federal prison.
yeah.
Because not only was I under the influence, but they found some counterfeit money on my possession. And I had about four bills, and for each bill, it was an X number of years, and it was going to be straight time, and I wasn't going to see the light of day for a long time. Uh, my parents bailed me out of jail, sent me to rehab, and I guess I could say the rest is history, right? I went to rehab, so the judge took uh, pity on me, I guess, if we can say that. And I was able to just do rehab, 6 months of sober living, and um, and 2 years of probation for my crimes. And uh, when I um, when I finish my 90 days in rehab, typically the last 30 days, they send you out to look for a job and make yourself a productive member of society once again. And I went out and I looked for a job, and I was hired by none the less than Riverside County. Okay. Who would have thought, right, that I'd be hired by Riverside County, especially coming out of rehab. And so I was hired by Riverside County, um, and that's when my whole work with mental health and substance abuse began. I went back to school again and got a certification in drug and alcohol counseling, um, and began to work in the field. Um, I started moving around and doing, wanted to learn more. Um, During that period of time, my father died. And I thought that was going to be the end of me. I thought, well, this is so painful. It's easy. I can go back. I can just use, just to kill this pain. And but I didn't. I made the right decision and chose not to. Um, but when my father passed away, I always say that he's the one that brought me to the feet of Jesus, because I met a pastor, and she introduced Jesus, and I accepted him as my Lord and Savior. And ever since, my life has completely changed.
Mm.
Oh, I'm sorry.
Yes, it's wonderful.
Um, Later after that, and see, you guys are gonna see how God took care of me, right? Because after that, I met my husband, who was a pastor for the
Mm,
Baptist church, and we got married. We have two children,
mm,
and God just transformed my life ever since.
mm,
Um, my husband encouraged me to continue my education, and it's because of him that I have my master's degree and I became a doctor. And so it's been it hasn't been an easy road, because being a pastor's wife is not an easy thing to do, much
mm,
less being pastoring churches and leading churches is very challenging. As most of you are probably aware, you're always in the fish tank, right? People are always
mm,
looking at you, um, looking at everything that you do wrong, looking at everything
mm,
that your kids do wrong.
yeah.
So, so it's challenging. It was
Mm,
challenging. He left the ministry about due to health reasons about 3 years ago, and now he's a chaplain. So he continues to do the great work for the Lord, but in a different way. And so that's a little bit of my story. Um, I hope it was not too much, but thank you for letting me share that part of
Thank you,
my life.
doctor. Thank you so much. Um, I was thinking about the, the only job I can think of worse than being a pastor is being married to a pastor. Um, pastor spouses take there should somebody needs to write a book about what they go through. But yeah, it is hard. The parish is a very challenging place because people who are broken go to church and they're there and they act out and they're not in recovery. Um, So that makes it challenging. But I didn't know. I wish you had told me I would need some tissue Kleenex to attend here today. That was you have an amazing story, just an absolutely amazing story. Um, but let's shift gears now and look at some of the information that you brought for us to look at here today to talk a little bit about what it's like. During the Q&A, I think we'd like to come back and talk more about your experience. Your story is fascinating. I think we could spend the whole time just on that. But I don't want to not cover what you brought. So let's make sure we get that in before we get into some details about your life.
Absolutely. So I'm gonna go ahead and share my shift gears, like Pastor Ed said. And so I work for the National Latino Behavioral Health Association. This is information about we put on a national Latino Behavioral Health Conference every year. This year we're going to be in Albuquerque, New Mexico. So those of you that are interested, please visit our website at nlbha .org, and visit our website, look at our information about our conference. We would love to have you. It will be a great opportunity to to learn about different things that are going on at a national level, and different ways to help the Latino populations. So again, would love to have some of you attend if you guys are able. But let me go ahead and go here. Let me see, it's not letting me. Ah, why isn't it letting me? It's not letting me move my slides.
Isn't
Uh,
that the way it always goes?
I know, and I don't know. It was working just fine a minute ago when I
Well, this doesn't look, is this a slide? Yeah, it is.
let me
Yeah, we
stop
tested it
sharing.
out before we started and it worked just great.
Yeah. So let me go here and let me see why isn't it working? Oh my goodness. My apologies for this.
Oh, you're fine.
It's not
We're
even
all
working on my end. So let me go ahead, let me close it and then let me reopen it and maybe
okay.
it'll let me do it.
And I think if she opens it and goes up to slideshow on the toolbar, that will start it again.
Let me see here. Slideshow. Well, I'm always a plan B person, so I will go with my plan B.
Mm.
Let me go here.
Oh, look.
Let
Yeah.
me go here and let me see here. Let me take my view. Okay. So today I want to talk to you guys about Sir Ed reached out to me to talk to you about mental health issues pertinent to Latinos in the United States. Okay, but before I do that, I want to introduce you and tell you a little bit about again a little bit about the organization that I work for. Okay. Again, our mission, the mission of the National Latino Behavioral Health Organization is to achieve behavioral health equity and to provide new programs that respond to the diverse needs of the community in a culturally and linguistically appropriate way. Okay, so this is part of the mission of NALBA. Um, and language is a powerful tool. Okay, so I want you guys to remember this. Okay, language is a powerful tool that can either uphold dignity or strip it away, right? So the choice of the words that we use can significantly impact how we perceive and interact with others. People's first language is a critical concept in fostering respect and inclusion for people with disabilities, emphasizing the person first and foremost rather than defining them by their disability, right? So, again, this approach creates a more inclusive environment that fosters empowerment, respect, and inclusion for folks that, for people that we interact with, right? And it also uh, creates a environment of uh, destigmatization. So, by focusing on the individual's identity and capabilities, we can create a world where everyone feels value and welcome to participate. Okay, so we always like to talk about the words have power, and that we want to use people first language, right? So, for example, instead of saying an addict, right, we want to say person with a substance use disorder, right? Instead of saying, oh, that person is hostile or aggressive, we want to say, oh, that person is protective, right? Because that's what a lot of people are doing. They are protecting, right? Instead of saying helpless or hopeless, we want to say they are unaware of their capabilities or unaware of their opportunities, right? Again,
Mm.
when we reword things, it is impactful, right? And it sends people different messages, right? So, in March of 2000, the Substance Abuse and Mental Health Administration, SAMHSA, and its Center for Mental Health Services, CMHS, acknowledged the growing mental health service needs of the rapidly growing Hispanic Latino population in the United States. And uh, by sponsoring a national Congress for Hispanic Latino Mental Health, SAMHSA determined that services must be more accessible and appropriate at that time. and responsive to the needs of Latino community, and declared the need for a plan to serve as a heirloom for the next generation. So the Hispanic Congress aimed um, to create a vision for Latino mental health for the new century. The conference at that time brought together national Latino leaders in behavioral health, research and services, advocates and consumers, family members, to define critical issues in behavioral health services for Latinos. And as a top priority, the group recommended the need for a single voice to address the mental health and substance abuse issues facing the Latino community. And in September of 2000, a steering committee of the National Congress met in Los Angeles and officially formed the National Latino Behavioral Health Association. And they gave us our official status as a 501(c) in 2002. So that being said, you know, NALBA's objectives for Latino Hispanic populations is we focus on policy issues in mental health and substance abuse, education and workforce issues, Latino focused behavioral health research, Latino family focused interventions. Um, our core values are to promote wellness within the Latino community, build capacity again, and increasing representation for Latinos in addressing behavioral health needs. We do a lot of capacity building, is what we mainly focus on. Cultivate, promote behavioral health awareness. We want to educate the Latino population, as we see that lack of knowledge is one of the biggest things impacting our communities out there. We want to achieve behavioral health equity, ensure implementation of cultural and linguistically appropriate services, and promote the development of Latino evidence-based practices. Um, so Latinos face the highest rates of mental health conditions such as anxiety, depression, and post-traumatic stress disorder. Uh, more than 1 in 5 Latinos adults report having a mental illness, yet compared to the 52.1% of white patients who receive mental health care in 2021, only 36.1% of Hispanic and Latinos received care. Okay, this is just to give you guys some data. So this gap highlights the disconnect that persists between many of the Latino communities and the mental health systems, right? There is a range of barriers that contribute to this gap, which include higher poverty rates, language barriers for those with limited English proficiency, cultural stigmas about seeking mental health care, high cost, and lack of insurance. There is also a shortage of bilingual and bicultural mental health professionals and limited culturally relevant services tailored to the Latino community. Okay, so these are some of the things that are going on out there, right? So despite many Latinos experiencing mental health issues, access to equitable and adequate care is difficult due to significant shortage of mental health care providers with multicultural backgrounds who can meet the unique needs of Latino communities in the United States. And according to 2021 data from the American Psychological Association, more than 80% of the country's psychology workforce was made up of white psychologists. Okay, so that means that our Latino peers, when they go to a psychologist, they're more than likely going to see a white provider, right? Latinos, on the other hand, make up a mere 8% of the psychology workforce. So only 8%
Mm.
of psychologists are Latino, and they're to serve our population.
Is that changing at all? Is it?
No, this is data that I just got, and is the latest data that is out there,
Mm,
Pastor. But as soon as it changes, hopefully
yeah.
it gets better, right? The Latino Hispanic community is made up of again diverse individuals, oftentimes set apart by their country of origin and ancestral history, right? So for Latino Hispanic community, mental health and mental health illness are often stigmatized topics, resulting in prolonged suffering, in silence, right? This silence compounds a range of experiences that may lead to mental health conditions, including, we have obviously immigration, acculturation, trauma, generational conflicts, right? Just to unpack immigration, right? We have like so many things, right? That the trauma, depending on, how they came, right? Did they come
Mm,
legally, illegally, right? It the traumas can be diverse and different, right? And then we also have the whole trauma of, you're being like uprooted, right, from your family, from your friends, from what you've known all your life, and you're being uprooted basically, and basically moved, right? It's kind of like when we take a tree by the roots and we
mm,
move it to another environment. That's basically what is happening, right, when we are migrating. Um, so additionally, the the Hispanic Latino community faces unique institutional and systemic barriers that may impede access to mental health services, resulting in reduced help-seeking behaviors, right? So, um, I hear stories all the time of folks saying, well, I went and I asked for help, and then they treated me this way or that way, or I didn't connect with the person. I asked for someone else, and that didn't work either. So I left, and I didn't come back until 7 years later, or I didn't come
mm.
back until 10 years later, right? So that also is creating gaps, right, in treatment, right? So we need to keep also those things in mind. So let me ask you guys, and if you guys can share one word, okay, that describes what you see in your communities, right? Each of you work in your own communities. And what is it that you see or that you feel in your Latino communities? What is happening? Do you see them? And let me give you some examples. Are they exhausted? Are they resilient? Are they afraid? What are you seeing in your communities? And you guys can put it in the chat. I would really appreciate it. Okay, I see someone saying a resilient family. Yeah, familismo. Okay.
Well, I'm in Minneapolis, so there's just the
Trust.
invisibility. There's just invisible
Invisible. Fear.
people. Yeah,
Fear, perseverance. Yeah.
yeah,
Okay.
right. And in survival mode, I assume.
Yes, absolutely. And that's what we are seeing in most of our communities, right? And Latinos, man, we are like you can, we will figure it out, we will sell oranges in the corner,
Mm.
uh, we will come up with something, right? We will do something to make sure that our families are taken care of. So there's a lot of resilience in our community. All right. So, studies found that a greater perceived policy in immigration and vulnerability and reported pandemic stress were associated with higher symptoms of depression. Increased PTSD symptoms were also associated with immigration policy vulnerability, right? Uh, More than 1 in 5 Latinos adults are reporting having a mental illness. Okay. This gap highlights the disconnect that persists between many in the Latino community and the mental health system. A range of barriers contribute to the gap, right? And I already mentioned some of those earlier. I mentioned poverty, and I mentioned uh, uh, shortage of bilingual staff, right? Lack of insurance or underinsurance, right? Um, in 2024, the Hispanic Latino adults were 12% less likely than US adults overall to report having a mental illness in the past year. And also in 2024, that's only a couple of years ago, right? Latino Hispanic adults were 28% less likely than US adults overall to receive mental health treatment in that past year. In 2023, Hispanic Latino female high school students were 17% more likely than other US females to report attempting suicide in the past year. And that is a big problem. Young Latinas have the highest rate of suicide, either ideation or suicide attempts in the United States. Um, So let's take a look at some barriers to care and again what else is happening, right? So we talked about lower insurance coverage and financial insecurity, right? It limits the access um, to nearly 1 in 5 Latinos, right? That lacks health insurance. Younger adults with serious mental illnesses often go untreated, right? And this also has partly not just the insurance, but also we have a lot of stigmatization, right, in the Latino population about mental illness, right? No queremos estar locos, right?
Mm,
We're not gonna go there to that, especially if the building says mental health, right, or behavioral health. Why? Because no queremos, we don't want to be crazy, right? We don't want to be labeled as crazy. Then there is a huge language gap, right? There's language gaps, um, shortage of cultural and linguistically concordant providers, lack of transportation, right? It all impacts the use of services, right? And I want to say a little bit more about language gaps, right? Because especially when we're not able to communicate in the same language, or we're not being understood, or we're being misunderstood on what we're saying, right? That language gaps lead to misdiagnosis,
mm,
right? And here I'm
sure.
talking only in behavioral health, but in the medical environment, it can even lead up to death, right? It can lead to serious consequences, language gaps, right? The not being able to communicate in our language, or something that we said being misrepresented, right? In the Latino culture, spirituality, religion is very important for Latinos, right? And a lot of times we'll say, oh, es que, la Virgencita me habló, or, like, soñé con mi mamá, and then, I dreamed with my mom, or my mom said, and quickly they want to say, oh, you're schizophrenic, or, you have, you're seeing things that are not there, and all these things, but a lot of those things are part of our culture, right? So again, we need to be understood. And when language is a problem, that doesn't happen. Again, the stigma, special beliefs that mental illness is personal weakness, spiritual failure, or locura, right? It discourages families from seeking professional help. Fear and mistrust of the institutions, right? Not trusting, right? Not trusting that person that you're seeing, because they don't understand you, they don't get you, right? Including worries about immigration status and public charge, also keep many away from services. So all of these things are barriers to care, right? Uh, the American Psychiatric Association digested several studies in 2017. Among its highlights, it found that Latino, Hispanic people are more likely to seek help for mental health disorders from a primary care provider. So I want you guys to keep that in mind, okay? Because you're the people that you're interacting with might not be going to a mental health clinic. Why? Because we don't want to be locals, right? But we can go and talk to our primary care doctor about, hey, you know
Mm,
what? I've been, uh, ansiosa, nerviosa, uh, or whatever it is that we're feeling, right? We'll go and talk to our primary care doctor, right? More than a mental health specialist, right? Um, Poor communication with mental health care providers is often an issue. There is, again, and I cannot emphasize this enough, there is a shortage of bilingual or Spanish-speaking mental health professionals. Um, Bilingual patients are evaluated differently when evaluated in English versus Spanish. That is a fact. Latino Hispanic people are frequently undertreated, more undertreated than white folks. Uh, Adolescents use antidepressants at half the rate of their white counterparts. Children use stimulants for ADD and ADHD at half the rate of white children. Mental health providers can be hard to identify because Latino Hispanic people will often focus on physical symptoms and not psychiatric symptoms during doctor visits, right? So, psychosomatic, right? Oh, me duele el estómago, me da dolor de cabeza, right? My head hurts, I get a migraine, you know, I I feel like I'm gonna throw up, right? All of those types of we tend to focus more on that than saying, oh, it's because I'm anxious. Oh, it's because it's a stress. We don't know estrés es cuatro, right? We don't know what it is anymore, right? 18% of Latino Hispanic people in the US do not have health insurance, right? Um, in 2018, 56.8% of Latin Hispanic young adults 18 between the ages of 18 and 25, 39.6% of adults 26 to 49% with serious mental illness did not receive treatment, right? So this is concerning, right? Because these are folks that, they are congregating in our churches, right? They come to our churches and they have a lot of things, a lot of issues going. Uh, Nearly 90% of Hispanic Latino people over the age of 12 with a substance use disorder did not receive treatment. Why? Because again, we don't want to, we have all these barriers, right? We have the stigma,
Mhm.
the language gap, the fear, the mistrust, right? In 2014, Mental Health America launched a suite of online mental health screening tools on their website. So I welcome you guys to go in there, the Mental Health America screening.org, which is www.mhascreening.org. Um, and it's a screening tool that you guys can use if you guys gonna want to use that with, with folks that you might meet for counseling or anything like that, to try and figure out better ways to help them, um,
Mm.
and where to send them for help, right? Because a lot of times, again, I think at church we tend to spiritualize things a lot, right? When in reality, maybe that person really, maybe they need just a little something to stabilize whatever is might be going on with them. Uh, Mental health wise, right? Again, language barriers can make communicating with providers difficult or even impossible at times, right? Particularly when a person is seeking counseling for sensitive or for uniquely personal issues. These topics are difficult for anyone to put into words at times, but is especially difficult for those who may not speak the language, right? And although Spanish, right, is the official language in most Latin American countries, some Latino Latinas may speak other languages or dialects, right? Such as Quechua, Nahuatl, or Portuguese, right? Uh, uh, Families may be bilingual or mixed language families. Therefore, it is helpful to provide to ask what the patient and the families prefer languages before even starting to talk to them, right? So, so when the providers for mental health, they need to keep all these things in mind, and it's not always available where where folks are going for treatment, right? So again, we want to make sure that we're providing support, right? The church is supposed to provide support. So when we're providing support and we're suggesting someone to go someplace, we want to make sure that at least some of these items are like checked, right? Off the checklist, that they are going to be able to receive the right treatment and the right care that they need. All right. So um, where do you guys see these challenges in your own congregations or neighborhoods? Do you guys see them uh, at all in your communities? Any of these challenges or barriers that I just spoke about? You guys can put it in the chat or you guys can unmute yourselves.
Yeah, go ahead and speak up if you want to address the question. So where do we see language barriers in
Yeah,
particular?
what do you see? Well, language barriers, or like, are you seeing any of the barriers that I spoke about, right?
Yeah.
Any of this, like, like language gaps, stigma, the fear, the mistrust. Are you
Yeah.
seeing, are you seeing any of those challenges within your own congregations or even in your neighborhoods, the neighborhoods where you guys are at?
Was,
Well, oh, sorry.
no, go ahead.
Well, I haven't experienced this lately, and I am not a Latina, but when I was dating a Latino, he had a very hard time understanding uh, my mental health issues and wanted me, like going to the priest was enough to take away my PTSD and stuff. And I realized then, you know, there's stigma in my culture, but also like it's different in some ways and similar in some ways too. My family thought, if I went to church more that would take away, and actually what I needed was treatment and help for my mental health challenges. And so it was just kind of a reminder of how, you know, religious institutions can kind of be harmful in a way and keep us from getting treatment in some ways, right? You know, and I see that still exists, today, even though I dated him many years ago, like this is still this conception of the only way to cure mental health challenges is through prayer, through confession, right? And that's what I, witnessed and observed.
Yeah, absolutely. So yeah, so I think, a lot of these challenges are cross-culturally, right? They are just like, there might be some differences, but like, there is a stigma. There is right. Maybe not language gap, or maybe there is, right? We have some other uh, cultures or races that are also underinsured or not, don't have enough insurance. Latino is not the only one, right, race that is underinsured or doesn't have enough insurance. We can see statistics about others as well. Yes, Magdalena.
I think one of the biggest barriers that I see in the Latino community here where I live is the undocumented population being, first of all, fearful that
Mm-hmm.
ICE will take them. And then, second of all, they don't have the ability to even obtain like public aid, right? A medical card.
Right.
Or, some of them can't even go to a free clinic because they don't have identification. So the lack of those things being in the community, it just, again, it doesn't allow them to get proper healthcare, first of all, and then second of all, again, our culture says, we're not, no estamos locos, no tienes
Yes,
que ir a ver a nadie, tú estás bien, toma agua, so they tell us to do these
agua para el
remedies,
susto.
yeah, these remedies to kind of get rid of our psychiatric problems, right, or challenges, and so all these things combined can just, there's no type of treatment that would possibly be suitable for somebody who's in that position.
Right. Absolutely. Absolutely. Yeah. So, yeah, so it's challenging, right? There is a lot of challenges, and we're seeing a lot of challenges in our neighborhoods. Now, let me ask you, let's address the next question. What are some phrases or attitudes about mental health that you hear in Spanish or English? Um, and I think I mentioned one earlier, like, right, like we suffer in silence, right? A lot of folks think that we only go to the doctor when it's an emergency, right? Like Latinos, we're like that, right? We only
Mhm.
go to the doctor if like, you have to be dying to go to the doctor, right?
Yeah, right.
Or how about like men don't talk about feelings, right? What other phrases or attitudes in health have you heard, either in Spanish or English? Anyone?
I think an opposite one that's opposite, like I remember my dad saying, if you go to the doctor, they're gonna find something wrong with you. So don't
Mm.
go to the doctor because they will find something wrong with you.
Ah, you don't want to know?
Yeah, that's right. Yeah,
Okay. Yeah.
yeah.
Yeah. Okay. Anyone else? Mm.
Well, I do a reference back to what someone earlier said, and that was the way that our religious beliefs get in the way of us getting access. And that was true for me. I didn't want to go to any kind of a 12-step group or treatment because I had Jesus, and I knew if Jesus would fix me. And Jesus was trying to get me to treatment, but I was, but I was dug into thinking that Jesus would just do it magically.
Right. And in addiction in particular, and I guess and even in mental health, right? A lot of times we think, we pray and we pray and we pray and we want God to take this thing away from us, right? Uh, but again, like I was mentioning, some of the stuff might be a little bit more serious, and we might need something to balance our right, the hormones in our hormones or
Hmm.
something in our brain, right? So we might need something a little bit more. I mean, schizophrenia is a lot more difficult than perhaps, a past trauma or anxiety, right? That maybe we can work in different ways. Magdalena, yes, I see your
Yeah,
hand.
I always say it's a balance of body, mind, and spirit.
Mm-hmm.
And so when one of those is not balanced, we need to or one of those is off, we need to take a look and see what we need to do to balance it. But everybody needs Jesus, therapy, and sometimes medication, right? Because there might be a chemical imbalance in their head where medication is going to be suitable, but along with some type of therapy and the spiritual aspect of it, which is also Jesus. So I always say we got to look at all three things and make sure that we're addressing all three of them at the same time.
Hmm.
Absolutely, because it has to be a holistic approach, right? We need a holistic approach, and again, there are different pathways, thank you, Pastor, for Ed, for sharing about, you didn't want to go to AA, right? You didn't want to go to AA. For example, for me, right? Um, I was introduced to AA and NA and all of the A's, right? Because I went to rehab, right? There are so many A's, right? And but those meetings, I started going to meetings, right? And I had a sponsor and I did all the things, right? But the meetings, I found them very triggering. They were triggering. It was just kind of like re-traumatizing for me to hear like all the war stories from people,
Mm.
right? And so, but when Jesus came in my heart and in my life, oh my God, that was life-changing for me. Right. So it can be, it can work either way, right?
Right.
Sometimes
Yeah.
Jesus is saying, hey, you know what? You need to go to NA meetings, or you need to go to a Celebrate Recovery meeting, right? I'm so glad that they have those now, right? Celebrate Recovery, right? Um, uh, they are Bible based, right? And it's not just about addiction; it's about any shortcoming that you feel that you may have, right? So you can
Hmm.
go to those types of meetings. So a little bit different, right? But again, there's different pathways to recovery, right? And it works different for everybody, right?
Yeah.
For me, like Jesus was, Jesus did it all, right? In addition to the little help from rehab, those 90 days didn't hurt
Yeah.
either, right? From being away from everything, from everyone, right? So all of that was helpful, but at the end, really, when Jesus came into my life, that's what was life changing for me,
Right.
right?
Yeah.
So, all right. So, uh, again, we've been talking about some recent events that have compounded right? Is stress, right? For the Latino population, right? Health and economic crisis. And even though we're past COVID, right? During the COVID-19 era, Latino communities were more likely to contract the virus, be hospitalized, and die, while also facing job loss and financial strain, right? These experiences continue to affect mental health. There's immigration and policy environment, right? Restrictive immigration climates and fear of deportation, right? We were mentioning that, right? People are afraid, especially, right? Everybody's, I'm afraid of this. Okay. Tell you guys a quick story. Um, when all of the raids started happening, right? And I'm a US citizen, okay? I've lived here most of my life. And when the raids started, right? Uh, you would hear, oh, ISIS over here and ISIS over there, or there is an ICE checkpoint over there, right? So you were hearing all of those things, and I was hearing it on TV. And one evening, my family and we went out for tacos, right? And there was like this little taco stand over there by I think it was like in front of a Walmart or something, I forget. But we got there and all of a sudden it was just like very quiet, like very desolate. I mean, it was just us and like another family there and stuff. And it crossed my mind, I was like, man, what if ICE pulls out right now? right? I mean, like, what
Mm,
business do I have having that fear, right? But yet
right.
I have it, right? So again, it impacts us all, right? What the news,
Yeah.
seeing social media, right? It impacts us, um and it has an effect on us, and I'm like, so, even I am afraid of mice, right? My,
Of
my girls,
course.
my daughters are afraid of mice. They tell my husband, Dad, don't go out. They're gonna take you because you're darker, you're dark skin. They're gonna make you Mexican. They're gonna deport you, right? Uh, Again, my husband, he's a U.S. citizen as well, but again, there is that fear. My girls have that fear, right? So again, it impacts us all, even if we are citizens here, even if we were born here, we born
Yeah.
and
Yeah.
girls as an example of that, right? Again, so we have all of these events and stressors that impact the community, right? Violence amplifying chronic stress, right? Um, and when we see all these events of violence, right, our bodies are, it's just like one event after another, right? It creates, it makes us sick, right? So again, poverty and less health insurance coverage, according to the Kaiser Foundation in 2019, 20% of non-elderly Hispanic people had no form of health insurance, in addition to facing an already limited pool of providers due to language barriers. So people that identify as Hispanic, Latino, have even fewer options when they are uninsured, right? And I think Magdalena had mentioned that, right? They don't have ID, they don't have these other things, right? So they can even get the medical care that they need. Teresa, you have a comment.
Well, I was just gonna comment that when have gone to my uh providers for uh health issues and stuff, even even the people who are there to translate for a patient is is afraid of ice and stuff. So it's not just the patient trying to seek help. I mean, the people who are there to interpret are also afraid. And, I think we just need to mention that too, because that's an important aspect of getting care is being able to have interpreters. But if they're scared to come out too,
Hmm.
how that
Absolutely.
impacts us getting treatment
Yeah.
and other things.
Yes, absolutely does, right? And we have all this fear going on, a lot of fear,
Yeah.
a lot of fear.
Well,
So,
there's a lot of us here that are really embarrassed and ashamed of what's going on in this time. And I mean, we want to be helpful, but we're not really sure what is helpful. Can you give some ideas about what's going to be most helpful for the Latino community?
okay, so sure. Let's talk about what are some things that you can do, right? As members of the community, as pastors, right? I put some of these things, and then I have the next slide that says some things not to engage in, right? But let's
Mm,
go ahead and take a look at this, right? So you guys want to make sure that you guys are trusted first door into kind of even into care, right? Because when someone comes to you in your congregation, they may be coming with a problem. It could be a medical problem, it could be a mental health problem. We don't know, right? So they come into care, right? Many Latinos are more likely to approach a pastor or faith leader than a mental health specialist. So remember that,
mm,
right? You're that first door. Be that trusted person, right? Offer psychoeducation in sermons if you can. Integrate some psychoeducation about, the importance of, normalizing, I guess, mental health, right? Having Bible studies or small groups where you're normalizing the struggles mental health brings or substance abuse brings, right? And share some basic warning signs, right? About these things like changes in mood, appetite, sleep functioning, right? Or even talks of hopelessness, right? All of
yeah.
these things so that you normalize it. Um, one of the biggest things that we can do when someone is coming to us and talking about hopelessness and like or saying like they are having like ideation like wanting to die or take their lives, is letting them talk about it, and typically we shine away from it. We don't want to hear it. We don't want to talk about it. And one of the best things that we can do is talk about it. So offering these spaces for folks to come in where they can come and talk about these things, I think is key.
Mm,
You can create and promote ministries that reduce isolation, right? Support groups, peer accompaniment, visit to families experiencing grief, and some youth spaces to talk about stress, right? You can also talk to your congregation about like what is it that you need, right? How can I support you better, right? And the reason I tell you this is because I have a story. I have a stories for everything, but I have a
mm,
particular story about helping a family on one occasion. The mother um, was my daughter's friend at school. The mother committed suicide. And so it was the dad was just left, right, with the little girl, and so we always wanting to help, right? So we wanted to help him, and this was it was a he was a white it was a white family, okay, and so. We put together like a food basket, and we put some things together, right? And we brought it over to him and stuff. And he was very grateful and everything. But at the same time, he was able to voice, and it kind of like hit me on the face, right? Because he was like, this is great. He's like, thank you for the food. I really appreciate it. But what I really need, he says, is I need a job.
mhm,
I need a job. So, asking people what they need, not just assuming that we know what they need. I think
mhm,
it's also something else that we can do, right? So before we run and try to bring them boxes of food or boxes of stuff, right? That we think that they need, asking them, how can we best help you, right? Because it might look completely different. Maybe they just need for you to give them again a number. Maybe you have someone that has someone that's hiring, right? And maybe that again, like this person, right? That's what they need. Yes, Pastor Michael.
Yes, I live in Woodbury, which is a suburb of Minneapolis, St. Paul. So the ice surge has just dramatically affected our communities.
Hmm.
And our congregation has had a very active addiction and mental health awareness uh, group that has been led, in fact, by Pastor Ed. And now we've just started one which is going to try to reach out and do more things to support the immigrant communities. I had a conversation with someone earlier this week who's the head of a food bank, and she was very clear. She said that, we don't just need food, we don't just need money, we need people to connect with our families. So make a commitment to that if you're going to do something, it's more than just giving us something that is material. We need the emotional support. So I think anything that we look at needs to be kind of framed in that context, that we've got to work and walk alongside them through this journey.
Absolutely, Pastor Michael, and that is so true. So sometimes, I was a therapist for many for many years, and a lot of times all the people need is they just need someone to listen.
mhm,
They just need someone to listen, and they need to feel heard. That's all they need. And then, it's like, okay, it's done, it's over, right? They need someone to hear them and listen to them without judgment. Right? Because a lot of times when we're listening to people, we start judging them, right? So steering away from being judgmental, just kind of just listening to them and just taking things for face value for what's worth, right? Some people, again, they just want to vent, right? And that
mm,
venting can look many different ways. It can be very passive, it can be very aggressive, right? So again, just giving them that holding space for them to discharge to unload, right? So these are some of the things that you guys can do. And excellent job, Pastor Michael. Congratulations on having that ministry, right? Providing emotional support, mental health, right, to the community because it is like again, it is so needed, right? They need a place where they can come and talk about their fears, about their concerns, right? About being the kids are afraid of going to school because they are afraid that they'll come home and their parents are gone,
Mm,
right? So those kinds of things. And again, the more that we talk about it, a lot of times we tend not to want to talk about these horrible things, but I think the more that we talk about it, it's like it makes things better for people. You know, it's kind of like when we talk about our addiction or our mental health problem, right? The more that we talk about it, there is like a healing process in that. There is something healing about that when we're sharing that narrative. Um, if I know for myself, every time I share my story or part of my story, it's just uh, a healing process for me. You know, there are times when I'm able to tell my story without crying, and then there are times when I'm just like, I just can't, right? Depending on what I'm sharing. So again, but it is all part of is that is cathartic, right? So
yeah.
it's part of that healing process. Now, some misunderstandings to avoid, because again, it does
Okay.
happen.
Hang on, and I'm gonna cut in here real quick.
Yes.
We have a sort of a commitment to keep to an hour, so
Okay.
we've gone over. I want to let those who need to go. I'm going to let you finish because I do want us to hear what not to do. I think that's probably as important as anything else you've said. But so if you can stay, please do. I'll continue that piece of the conversation. But for those who need to go, let me send you off with a prayer, and then we'll pick this up again. But let us pray. Holy One, Holy God, give us wisdom for daily choices, gentleness when pain shows up, courage to tell the truth with love. Help us to be communities where people do not have to hide, where faith and care walk together, and where healing is allowed to take time. We pray in Jesus' name. Amen. And if you're going, go in peace, be a blessing. Thanks for being here. Yeah,
All
now
right.
tell us what not to do.
So these are some of the things not to do, right? Again, do not suggest that prayer alone should replace clinical care for especially for serious depression, psychosis, or substance use disorder, right? Emphasize both, right? That faith and professional support are important, right? A combination of both.
Mm,
That's what will do the trick. Avoid blaming families for systemic problems such as poverty, racism, or immigration policy, right? Name this as injustices, right? And that the faith community can advocate to change, right? Remember, we're advocates, right? We're not just faith leaders in our communities, we're also advocates. And do not minimize the impact of immigration status, discrimination, or gender-based violence. Acknowledge this explicitly and respond with safety, confidentiality, and referrals. Okay, so make
mm,
sure you have referrals, referral, especially for serious mental health problems, right? You want to refer um, uh, folks that are in your congregation, you want to refer them to the right place and get the
mhm.
right help. So, and now I will stand for questions if anybody has any questions, and I'll stop
Yeah.
my sharing so
So,
we can see
so that
everybody's faces.
there's a lot of us who don't have direct access to people from the Latino community. We live in areas where there aren't a lot, or there may be, but they're not coming to our particular church, and yet we want to feel supportive. I mean, so if we're not having direct contact, what are there other things we could do to be supportive? I know in my community there's a Mexican restaurant that's giving its proceeds to help support the immigrants in Minneapolis right now. We went there and ate and to be supportive, but I was struck by the fact that they had to unlock the door to let us in, and then they locked it behind us, and so you had to have a reservation to eat there, otherwise the doors were locked just out of safety. But it just made you realize that these are people certainly living in fear, and it breaks your heart.
Right. Well, I think, if you don't have direct connection to the Latino community, I think one of the most important things that we can do for the Latino community right now is pray for them. Prayer that, that God keeps them safe, whichever way, right? Because if they do get detained by ICE, they have to go back home, right? at some point. So just pray for them for their safety, right? I think that's
Yeah.
one important thing that we can do, especially if we don't have direct access to the
Yeah.
community. You know, you can also collaborate, perhaps collaborate virtually, right, with other churches that do have direct contact and
Mm,
finding out in what ways your congregation can be supported to that congregation that does
that's a
have
great
direct
idea.
contact, right? So again, you know, there's a lot of things that we can do as a faith community, you know, and also, you know, again, you know, very, you know, have it being, you know, have all these things done in very respectful ways, right? So,
Yes.
yeah.
Yeah. Others?
Any other questions or any comments? I want to
But
thank
it,
you guys. I think most everybody stayed, so thank you guys for staying.
yeah.
Goodness, I
Well, I
appreciate
would like
that.
to say thank you to you for your time and for your story, which is incredibly inspirational. I'd like to invite us all to that react button at the bottom of your page. There's a heart there. If you want to applaud or share a heart to say thank you to Pastor Chavez-Mancillas, um, we're giving you some love here.
Thank you. I
Yeah,
appreciate
thanks
you
for the
guys.
work you do and blessings to you.
Yeah, and
Um,
if there is anything else, you know, any other way that I can be of service to your group, please, you know, please reach out.
yeah.
You have my email. You
So
have
I have a question.
my
What was it? What did the faith community help you in any way during your transition as an immigrant?
You know, when I came at 14, I was obviously I was not a Christian. I was a practicing Catholic.
Hmm.
And I, you know, like most Catholics, we do, you know, when I was a Catholic, what we do, you know, we go on maybe on Sundays or, you know, major holidays.
Easter and Friday, Easter and
Yeah,
Christmas.
right. Right. So I mean, I think that was the extent, and I was a kid, and my my sister and my brother-in-law were Jewish. Well, my
Mm,
brother-in-law was Jewish, so you know, I was taken to temple a couple of times with them and with her in-laws. So you know, it was just you know there wasn't really you know I didn't really have a faith community that was supporting me
right.
at that
Yeah.
time. I think perhaps things would have been different if
Sure.
I had, but you know, I
Yeah.
will never know.
Yeah. Well,
But
I'm just curious how, I mean, that's an incredible experience. I mean, being uprooted like that, as you said, and
Mhm.
starting your whole life over in such a strange place. One of the things I wanted to ask you was what's going on with the Latinas, teenagers, that they're committing suicide? What's going on there, and is
You
anything
know,
being done?
uh, you know, it's you know, I would need to do more research on that, Pastor. You know, I do know that they are the most impacted with suicide and wanting to commit suicide. We have the larger percentages of
Yeah.
Latinas, and uh, I would imagine it has a lot to do with you know, different stigmas, right?
Hmm.
Different situations going on. Uh, you know, the stigma of being a woman, you know, even in the Latino communities, right?
Yeah.
Being female, right? In some of our countries, being female is not as valued as being a male,
Right.
and that has a lot to do with it, right? How they are being treated. Um, we might also be seeing some abuse going on, right?
Yeah.
And maltreatment. And so, you know, all of those things impact their mental health and
Yeah.
not being seen, right? Because again, not in all of the Latino countries, but in a lot of the Latino countries, you know, like in
Yeah.
the country where I'm from, you know, you're less valued if you're a female than if you're a male,
Yeah.
you know.
And where are you living now? Are you in California?
I'm in California. I'm in a city called San Dimas.
So how do you experience racism today? Is it a regular fact of life or
Well, you know what? You can see my skin.
yeah.
So I have I am white passing.
Mm,
And so I don't typically face racism as much as my peers. I don't know if it's a blessing or we want to call it a curse, but I do encounter a lot of the privileges, right? That the white community encounters because of the color of my skin. Sometimes, it may a little bit go away if I start talking. People hear my accent. Sometimes it comes out. Some of the words I'm still not, able to pronounce them appropriately sometimes, or right, or I'm not able to articulate them well. But typically, I typically don't. I don't face a lot of racism personally, but I do know my husband does, and my girls have experienced some. Especially when they, say that they are bilingual, that they speak Spanish, and it's looked down upon.
Mm,
So, but me directly, not so much.
yeah.
Yeah.
Well, I asked that because I know. Yeah, go ahead, Adrian. Oh, you waved your hand. I thought maybe you had something to add to it.
I
No, you
think
were
he's
agreeing
wanting
with it.
to.
He was
He's
agreeing with me.
okay.
Yeah, I was
Or
just
w-
saying thank you. I appreciate everything that you've
yeah,
done and share. It's so important. Me as being a Latin and helping the Latin community, I do a lot of work out here in Somerset County, and this is real important. It's dear to the heart, and I
yeah,
appreciate it. I'm out here doing the footwork, and I know what it is out here. So thank
yeah,
you.
Oh, thank you,
yeah,
Pastor Adrian. And
All
yeah.
right.
keep up
Well,
the good
Bye.
work.
I'm sorry for your people and what they're having to go through here. It's not right. I never thought I'd see something like this going on. Um, it breaks my heart.
Everybody stay safe and have a great
Yeah.
day.
All right. Well, hope this passes soon.
Thank you.
All right. I'm going to close the door now. Thanks for being here, everyone, and God's peace be with you, and hold the faith.
Thank you so
So,
much, everyone. It was great meeting you all. Take care.
all right. Bye bye.
Bye-bye.